about if somebody were to say, you know what, I'm having an issue, how do I go about finding a good physical therapist? Because, they say the same thing about chiropractors. There's good chiropractors and there's bad chiropractors.
Sure.
In my world, mostly it's referral, but with you guys, because oftentimes you need a direct referral, how do people know the doctor is sending them to a good physical therapist?
Well, yeah, that's a tough one. In today's world, because physician-owned physical therapy practices are becoming a big thing. It's a revenue stream for the physicians, as healthcare, payments are getting less, costs are getting more, salaries for, extra staff for an office are going up, and again, reimbursements are going down. So there's been a lot of that. Not to say that there aren't good therapists in doctors' offices, but I think the true passion and love for the field may not be the same. They're there working for somebody, getting a paycheck, and that's kind of it. Whereas me, I'm here. I'm kind of like Steve. I'm here at my patient's needs. If they need an early one, I get in here early. If it's somebody that I can't get in and they have to have an 8 o'clock at night because they're flying out, I try to make it work around my schedule to get in and take care of these folks. So we kind of back to the other question, kind of in combination. So that's part of what makes, I think, like with Steve and like with myself, physician-owned practices, and then you have a lot of big corporate name brand physical therapy that are nationwide. And again, not to say that there aren't just wonderful therapists that are out there doing the work, because it's not easy to get out on your own and get on plans and get relationships with doctors to get those referrals so that you can cover your overhead and possibly even put food on your own table first. So it's getting harder and harder to find a good private practice therapist that's an independent small guy. So of course I lean towards that. I actually had a therapist call me from Colorado. Said my dad had a knee replacement. He lives in Gurnee, and he was going to go to the physician owned. And again, they probably know his protocols. It would be wonderful rehab, but her as a private practice therapist said, no way. You're going to find a private practice guy. She interviewed 3. She found 3 small practices, interviewed us all via phone, and ended up actually coming to visit me from Denver during her dad's care.
So this is a physical therapist referring her patient?
Yes.
So it's the physical therapist calling around to find out.
Right, so her being out of state, she wanted to find a private small practice, much like her own, where basically she knew her dad would be able to come in, feel at home, and get taken care of. And that kind of goes back to what I love about my office when Steve mentioned, he'll walk in and there'll be a back and a neck and a foot laying there. It's kind of an open gym approach. And the patients I found have really desired that. They've enjoyed that. I've had people lay down on the table and rejuvenate friendships, neighbors that lived next door 15 years ago, and all of a sudden they're both in therapy and see each other. So neat things like that happen. People get along. There's a camaraderie. Oh yeah, I had ankle surgery. I sprained my back mowing the yard. They end up folks just
they help each other.
They help each other. I joke all the time. We only treat nice people because people have really come in to see what I'm kind of, I think, like Steve in a lot of ways, where people do take life a little too serious sometimes. And so even though they come into my therapy office, you know what, everybody's there to get well and feel well,
and it's taken seriously.
It's taken very seriously,
but
at a level where they're comfortable and they don't feel
they're not intimidated.
Yeah, they're not intimidated. They don't feel like it's like, oh boy, work was great, now I have that medical appointment or whatever kind it is. I think they see it as a highlight in their day.
What's your least favorite part about being a physical therapist?
Least favorite part is probably just fighting with payers, insurance, paperwork, all that stuff, because that tends to sometimes get in the way of what we really want to be doing, and that's helping people get back to their functional quality of life that they're looking for.
In my world, I always talk about the pieces of the puzzle, and I like them to walk, I like them to stretch, I like them to do cardiovascular stuff, I like them to look at postural stuff. And so when I talk about things that they can do outside of my office, I'm very proactive that way, because when they need you, they'll come back, and when somebody else needs you, they'll send them to you. So what about in your world? I know that you and I have talked about, and you've always said, you are your posture.
Right.
So if people want to stay out of your office, what are some of the things from a physical therapy standpoint that they can do to really help keep that dream alive?
Right. Well, what I'll explain to people is that you become your posture over the course of time. Posture being a static or stationary position that you spend time in. So, most people correlate that with, sit up straight, your posture. But like right now, my legs are crossed and my feet are pointing down, and so my ankles are in a posture, my knees are in a posture, my hips are in a posture. And so when you leave connective tissue, collagen particularly, in a shortened or a lengthened position for a prolonged period, it will change, whether it's shortening or lengthening. And so if you think about what you do all day in your life, whether it's an hour-long commute, or you're at a computer all day, or you're on your feet all day, all of these things, you slowly become your posture. You can always point out a retired dentist in a crowd because they're really over. And what have they done their whole lives? They've been hunched over people, looking in mouths, and then they're at their desk hunched over charts writing them. And so you slowly become your posture. And you see that, we're seeing more and more of that with the computerization of the world, with people sitting at desks and working at home, and they're getting here. And with that, they're getting a lot of neck, a lot of shoulder,
head
a lot of
forward
carpal tunnel
posture,
stuff, all these things. So it's like I said, it's not just your head and neck and your back, it's the whole chain. And so things you can do are, is change that. Pay attention to it, be aware of it, and take breaks. If you're sitting in a computer for 5 hours, even if it's for 1 minute every 30 minutes, if you can just stretch your legs, stand up straight, take your neck through its range of motion, do something so that you're not in that stationary posture the entire 4 hours or whatever amount of time that you're going to sit without a break.
Outstanding. Hey Mike, if people want to get in touch with you, what would be the best way to do that?
Well, the best way to do it would be to call me.
and what would that number be?
847-996-0650 is line 1 to our office. If that's ever busy, 847-996-0652 is our second line.
Do you have a website that you would like to call their attention to?
We do. It's kind of new, and it's looking pretty good. It is Momentum PT, P as in Paul, T as in Tom for physical therapy, Illinois. So Momentum Physical Therapy, MomentumPTIllinois.com. There's another physical therapist in the south suburbs that I actually know that actually also has the name Momentum, and her website was the shorter version, so mine is MomentumPTIllinois.com.
Hey Mike, I appreciate you taking time out of your day today to come
you.
over and talk with us and to help some of the folks out. That's it for today. I'm Dr. Steve Segal from www.libertyvillechiropractor.com. Thank you so much.